It is still the conversation, and we thank you for staying tuned. Health and the environment is one of the pillars of the Themes Plus agenda of Governor Babajide Sanwo-Olu. Now, this shows that the state government prioritizes the health of Lagosians. With the increasing demands on health care, maintaining quality and safety standards across health facilities in the state is paramount. Joining us is Dr. Idowu Abiola, the Executive Secretary of the Health Facilities Monitoring and Accreditation Agency, HEFEMA, who will take us through the roles of the agency in promoting quality service in health facilities in Lagos. You're welcome, Dr. Abiola.
Thank you.
All right, let us begin with HEFEMA's primary responsibility in the health sector.
Okay, so HEFEMA, that's Health Facilities Monitoring and Accreditation Agency, was established by the Health Sector Reform Law in 2006 to improve the quality of care by setting minimum standards and ensuring that those standards are complied with. We ensure compliance of the standards by inspections, monitoring, and then accreditation. So we set standards for the various categories of health facilities, and standards are very crucial.
Both public and private?
In both public and private health facilities. Standards are very crucial because they establish mechanisms that are measurable and so that health facilities can comply with these standards that are set. The standards cover various aspects, such as the infrastructure of the health facility, regardless of the category of the health facility, the staffing requirements, the equipment, the protocols, the safety measures that the health facility must comply with. And of course, I think I've talked about the protocols, not only even the infection prevention protocols and any other relevant protocol that a health facility must, yes.
Right, I mean, Joy was quick to add while you were speaking, and she said public and private, and you said both. Yeah. But a lot of people think that because you're a Lagos State agency, you turn you turn the other way when it comes to monitoring health, the facilities in public health facilities. Can you take us through? Are they pampered with the kit gloves, or do they also go through what the private facilities also go through in terms of ensuring that their facilities are up to date, ensuring that all of those things that you check in the private facilities, you also do at the various public facilities?
Yes, we do carry out inspections and monitorings in both public and private health facilities. If you will notice, some secondary health facilities carry our logo.
Right.
Yeah.
And since the inception of Mr. Babajide Sanwo-Olu, the administration has emphasized the fact that even public health facilities must be measured with the same standard that private health facilities are measured with.
Okay. Do these also include the PHCs?
Yeah, yes, it includes the primary health care centers. Before any health facility can offer services under Ilera Eco,
okay,
they must be registered with the state. The HEFEMA must have visited that facility and given it an okay that they have a basic
average,
yes, or a minimum standard that they can provide service to the citizens of Lagos State.
Okay, so could you walk us through the process a health facility needs to go through before being accredited or certified by
Okay,
HEFEMA?
so the process of registration. Okay, so any health facility, regardless of the category, must have some minimum requirements. First, the facility must be a registered business, and that will be evidenced by the certificate of incorporation. We would know that the person in charge of that facility is not faceless. The person would have a LASRA card, will be a tax-paying individual in Lagos State, and then you would also inform us that this is the location of my facility. All that is actually done on the portal. You upload all the requirements on the portal. Before you upload the requirements, of course, you would have given us like a letter of intent through the Honorable Commissioner or the Special Advisor to the Governor on Health, saying you want to register your facility. Once that is done, and we're able to give you an approval on the portal, then we'll go and visit the facility to see that the equipment, as I mentioned before, that the standards of that facility is in compliance with the standards that we have set. And just to make it also easy, we have standards for all categories of health facilities, and it's also on our website.
Okay.
So,
have you had to turn down requests because based on what the owner of a facility had filled as your requirement, and on the spot assessment, you realize that that facility has is not measuring up or does not have all the required facilities? Do you give them time to get themselves prepared for your approval, or do you deny outrightly?
okay, so when we visit a facility and the facility is not in compliance, or is substandard, we would deny.
Okay,
yes,
the
we would deny the request. We would not approve the application, and during the time that we give the facility to say you need to,
upgrade.
Yes, upgrade. You need to put certain things in place to ensure that you are in compliance with our standards. You are not expected to provide service because you cannot provide service in a substandard facility.
Right.
And once the facility is ready, they inform us that they are ready for a re-inspection. When we go back for a re-inspection, the facility must not see that the facility is already providing service. Yes.
Okay.
So if we go the second time and the facility is still not in compliance, we still tell the facility,
you're still not ready.
Yes, you are not ready. You are not supposed to provide. By the time we go the third time, we'll do a closure. And then, we'll put it in writing and expect that facility to, when they are ready, they'll come and inform us.
Again,
yes, then we'll reopen. Yes, and then the process will start all over again.
Wow.
So this is for a facility that is about to start. How about those who have already started, or maybe have been accredited by you? At what point does the facility get shut down?
Okay. Oh, all right. Okay, so we have some things that we do not, quote unquote, forgive. So a facility that does not have the requisite health personnel in terms of the number of doctors, the number of nurses that they're supposed to have is not a facility. So that if we visit a facility that does not have qualified personnel manning the facility, yes, we shut down. If we visit, that's called quackery. You're not supposed to, although there are different forms of quackery. But you are a quack, you're not supposed to run a facility. So we shut it down. And then recently we have had, because of the shortage of particularly nurses, we have had some facilities training, turning themselves into training institutions by training nurses. So that, because we do not want to perpetuate quackery, we shut down facilities like that. And then if we go to a facility, if, for example, they have poor waste management, what we do is issue a notice of non-compliance, because we have different instruments. We have instruments of monitoring and inspection. We have a non-compliance notice. We have a closure notice and notice of findings, what we just tell the person. So depending on the gravity of what we, of what we find. So if it is something that we know the facility can, correct immediately, we just give a notice of findings, and we tell them this is what we expect you to do. And then by the next time we visit the facility, of course, we expect that that facility would have corrected it. If it is something grievous but not too bad, we issue a notice of non-compliance, and then we still expect that by the next visit, the facility would, but a notice of non-compliance, it's a warning. It's like a warning. Yeah. So if
do you also give a timeline?
Yes.
Okay.
We give time frame depending on what the infractions are. So I can give you examples. So, for example, we visit a health facility and there is poor waste management. We give like 2 weeks for the facility to correct, maybe buy appropriate bins, ensure that the bins are properly lined, because there are different
colors.
color-coded bins. And then, of course, the commingling of waste, ensuring that you do not mix domestic waste with medical waste. Yes. Okay, so we give like 2 weeks, expecting that by that time
there should be a change.
Yes, there should have been a change. But if we find, so for example, we visit a health facility, there's supposed to be doctors and nurses, and we find only nurses, and it's perpetual, we issue a closure notice, but we do not close. Because there is a medical staff, because they will tell you, oh, our doctor has gone for lunch, but when you keep saying our doctor, yes,
for lunch.
Okay, so we issue a closure notice, meaning that we have put you on notice. But if we visit a health facility and there is no qualified staff, we do not issue a closure notice. That is not a health facility. That's just a place where people come and then you are giving them substandard care. Yeah, so that is like an indication for immediate closure.
So oftentimes when you visit these facilities, you do not give them prior notice. You visit unannounced, or do you give prior notice when you're visiting, or how do you also structure your visits on a yearly basis? How many times do you visit?
Okay, so according to our mandate, we're supposed to visit every registered facility twice in a year. But it's a struggle because currently, as at September, the staffing and then the number of health facilities in Lagos. As at September this year, we have registered 5,537.
5,000.
Yes, although that in that
space
cohort, we have some of them who have relocated, some who have shut down, some we have shut down. So, but then, of course, we visit unannounced. And according to our law, we can visit any health facility unannounced between the hours of 8 a.m. and 5 p.m. Yes. Although there are instances when we visit unannounced, when we want to carry out enforcement, and we know that, that happened recently, maybe it happened last month. We had a whistleblower sending an email telling us that this facility is training auxiliary nurses, and the auxiliary nurses are providing service, but it happens only after 6 p.m. and it's somewhere in Okokomaiko. So some of our staff left the office at 6 p.m. just to go because it was an enforcement. But the usual monitoring is between 8 a.m. and 5 p.m. unannounced. But if it was an accreditation, not a monitoring visit, an accreditation is a step above. Yes, accreditation means that I want to provide excellent service, not the basic. Okay, so an accreditation, we actually write, we're both in agreement that this is when you are going to come. Yes.
Sorry, Joy, I'd like to a follow-up, and what you raised now, I'd like for you to please clarify, because again, sometimes we do not know the difference between a clinic and a hospital. So, so if you're getting an accreditation for a hospital and your facility can only provide a clinic, do you still go ahead to accredit as a clinic and not a hospital? So can you clarify for us, what does a clinic do and what does a hospital do? And then what are the criteria for knowing that this is actually a clinic and this is a hospital? Okay, so that I would try, because I would try within the space of time. So you see, a clinic, ideally, it's a place where, your client or your patient comes and you provide service. The patient, it's
it's an outpatient.
Okay.
A clinic
so
is
clinic
basically for outpatients.
Okay.
Yes.
Okay.
But sometimes when you have patients that you want to observe,
Okay.
you can keep them for 24 hours, but not more than 24 hours.
Okay.
And a clinic basically has only 2 beds, and
Okay.
they're observation beds.
Okay.
But a hospital, even if a hospital has like 4 beds, you know, sometimes you have hospitals that are specialized.
Right.
Yes, they carry on services
Care and treatment.
throughout.
Okay.
Yes, and treatments. The
Right.
patient will be on admission for as long as
It's
is required.
necessary. Okay.
Yes. So that's the basic difference. And then, of course, there are certain procedures
Okay.
that you do not expect a clinic to carry out.
Okay.
Yes, because for a clinic, you do not need more than that clinician and a nurse and those who will provide support services.
Okay.
But a hospital, you should have at least 2 doctors and at least 3 or 4 nurses.
Nurses,
Yes,
okay.
because it's a
It
24-hour
requires,
service,
okay,
and
more
yes,
hands
yes,
and
day
more
in, day out. Yeah. So the clinic as well, we have specialists. Hospitals as well. We have specialist hospitals and multi-specialists, depending on the scope of service. So the scope of service is what determines the category. So, for example, someone can request for a clinic, knowing that the scope of service would exceed that. It is when the inspection team gets there that the person is advised that
Why
this.
don't you just
No,
upgrade
it's not. Why don't you?
You must.
You must.
You should.
Yes, you
Okay,
must.
all right.
And then, so it is after inspection that we can categorically say that this
Getting
is
approval for either a clinic
or a hospital. Yes.
Okay, I want us to talk about patient safety now. It's a critical issue. So
Yeah.
how does HEFEMA ensure that this health facility prioritizes safety of patients?
Patients. Okay, thank you very much. Because patient safety is one of my something I'm passionate about. Yes.
Okay.
So, patient safety. When you are talking about patient safety, one of the things that you must ensure the facility as is, or that the facility is that the facility is complying with standards. You must have standards that there are some patient safety standards, and in terms of how you relate, even how you relate with your patients is very important. Communication with your patient, you must engage your patient to ensure that that patient is taking his or her drugs, understands what you have told, yes, in terms of the drug. Then patient safety also relates to the structure of the facility. So, for example, you go to a facility and that facility has steps,
Okay.
or just one step. And this I'll just give this example. We have a petition now that someone says, I went to the toilet and as I was coming out of the toilet, I fell. That is patient safety. The facility must ensure if there is a step between the like the reception and the other room, there must be a caution sign, letting the patient know that is patient safety. The floor,
Slippery, wet
yes,
floor.
that is patient safety. You must be in a facility is not a house, it's not your home. Even your home, you must be safe in your home. But the safety of the patient is paramount in a health facility. The patient, even in terms of infection prevention, your patient should not come to you
And then go home with
another
yes, that was something you didn't come with. So that's also part of patient safety. The way the bed is structured in a hospital, the ventilation, illumination, that's part of patient safety.
Okay.
Yes.
Right. So let's also talk about the TBAs, the traditional birth attendants, and those who provide that service. Are they also? Do you also ensure that these TBAs have approval to, you know, operate in the first place, because they also sometimes say that our facility, and then can they hide under any, is there any hiding place for them not to get registered?
Okay, so first, TBAs are not under a farmer.
Okay.
Yeah, so they are under Traditional Medicine Board.
Okay.
But because of the fact that health is the health sector, where
there's inclusion.
Yes, there's an inclusion, and our services are integrated. We collaborate well with all the other health agencies.
Okay.
So we work well with the
Traditional
Board. Traditional Medicine Board.
Okay.
We go on joint inspections.
Okay. Okay.
We have like a timetable to say, okay, this is our time to go, so that we visit facilities that are providing traditional medicine to ensure that, yes, together, to ensure that they are strictly compliant.
Right, because they also could be endangering the lives of the patients.
Yes. And as I said, that we work well together. If, for example, they visit any of their facilities providing orthodox medicine, usually they inform us.
Okay.
Yeah, that we should.
So at least there's that synergy.
Yes, there's a synergy between us. Yes. So
how do you get feedback from patients or the public? How do you address complaints? Is there, you mentioned a whistleblower. So if I want to be a whistleblower, how do I go about it? Okay. And how apt are you to respond to complaints raised?
Okay, thank you. So we, in situations such as this, we continually voice out and say, let us know if you have visited a health facility and you are not satisfied.
With the
with the care. Yes, you think that the care you got was below par, that it was of poor quality, or that you were treated by someone you suspect is not a doctor or a nurse. Yeah. So we have social media handles. Can I reel them out, please? Because I've been saying it out. Okay, as we close. So we have, thank you very much. So we have social media handles, and then at events, we let people know. We are, and you don't have to tell us your name.
Okay.
So you can send it to either to our email, you can send it to the Ministry of Health, you can send it to, if you send it to any ministry, or they will forward it to Ministry of Health, and it definitely gets back to us. Yes. And we get it through our mails. Sometimes people will call, and then sometimes they will tell professionals, and then they will tell them, oh, have you contacted a farmer? So,
right. So facilities should renew their registration with you every year. Is that also done via the portal, or how do you also ensure that that is done? Because you also have people who, for some reasons, will just not be nonchalant and not carry out their yearly with the farmer. How does that work with you? And have you had to, because of lateness in registration, have you had to downgrade a facility because of either lateness, or do they also do, are there penalties for late payment or yearly registration?
Okay, so ideally, as you said, it's annual. So a facility that is not renewed, but if you have like a certificate of registration, but that certificate of registration is not renewed on an annual basis, you are not registered, technically.
It's as good as you're not registered?
Yes, technically, because it's in our law that registration must be renewed annually. Yeah. So technically, you are not registered. So that is number one. So, and our law says that you are not registered, you are not supposed to provide service. Yes, it's in the law. Then they are supposed to, first put in documentation on the portal before the monitoring
team.
Yes, yes, monitoring team visits the facility.
Right.
Yeah. So, but if you after the 30th of April,
Okay. A new year starts.
Yes,
okay.
in renewals. And technically, since the new year started, even the portal
closes.
It will not close, but there will be a penalty in payment.
Okay.
Okay.
Yeah.
All right.
And if you do not do that, I mean, if you don't make that penalty in payment, you'll not be able to move forward. So it's just a deterrent.
Right.
So most.
Has that helped?
Well, for those healthcare professionals that are serious.
Okay.
Yes. So sometimes the associations come to us to negotiate.
Okay.
On behalf of
yes, that's okay. We should please adjust the portal so that so at least for like a month, so that they can all, push in their documentation en masse.
Okay, but do you send reminders just for just playing the devil's advocate here? Sometimes people forget.
Okay, so well, that's something we can do.
Right.
We can take, but what we do is we give reminders on, because we have like WhatsApp groups with the associations, and then we also have stakeholders meetings.
Okay.
Yes, so we tell them, look, the time is coming, please do your renewal. Yes.
Okay, so this will lead me to ask then, what are some of the challenges that HEFEMA has faced, in ensuring the standards are met in the health facilities in the state?
Okay, so that's what challenges that we have technically. Okay, so there are some places in Lagos State. I'll start with the terrain. I want to start with the physical challenges first. Okay, so the terrain sometimes can be a challenge, and then places that are a bit far-flung, like Badagry, because of the roads and the rain. Yeah, that is a challenge for monitoring. So, yeah. And then, of course, because we're very few in number, the staff that carries out monitoring is very few. But that we have been able to ameliorate by franchising out our monitoring activities to reputable organizations. That in itself can be a challenge, because then, although we want them to act like us, but sometimes
they compromise.
Well, maybe not really, compromise, but yes, maybe not compromise, but because the staff in HEFEMA, they've been doing this job
for so long.
Yes, repeatedly for so. Yes.
Yeah, the zeal.
And the organizations have just started. Okay. So we are going to still need to So we do continuous capacity building. Once we get complaints from health facilities to say, oh, okay, I was visited and I didn't like it is and then we'll do capacity building. Right. Again, we do it continuously. We train continuously to ensure that they're able to act like us.
But year in, year out, how would you rate the acceptance level? Because again, sometimes, change is sometimes resisted.
Yeah.
But year in, year out, when you look at how much the health facilities that you visited are also raising up to your visits and looking up to your visits, are there, does this spur you to want to continue, irrespective of the challenges you've mentioned?
Certainly. There are some, I would tell you the truth in saying that there are some facilities in Lagos that are not supposed to be in existence. Truly. And then, because people would tell us, I found your logo in a strange environment. See, so some of those facilities, they just, at the beginning, they probably got the logo and the certificate of registration, but then, yes, that is it. So there is no, and then because of the dearth of healthcare personnel on our side to go on monitoring, we have probably not visited that facility to say, okay, you need to step up. Okay, so but we're trying to do something to that in the sense that we're, by the beginning of next year, we're going to have QR codes at facilities.
So
for those, yes, that you know the status. So if facility you visit that doesn't have that QR code, even if it has a logo, means that that facility is, the status of that facility is not up to date. Yes, that is number one. Number two, you see new facilities are springing up. If you look at it, and these new facilities, you have fantastic facilities. People are, I mean, the awareness to, I mean,
publicize
to,
those facilities?
no, to establish facilities now that actually is comparable with global standards now is, I think the awareness is more. And people, a lot of people are investing in healthcare. And it is something that is heartwarming. Is making, I mean,
the job easier.
Yes, it's making the job easier. So that in itself is improving the landscape of quality in healthcare.
So before we allow you go, does your law also allow you to prosecute?
Yes, definitely.
Okay. So have you taken that step?
Okay, so yes, we do. In fact, since we can sue and be sued, we have some health facilities that have sued us because we closed maybe a section of the facility. And we also prosecuted some quacks. Yes.
Are the laboratories under you too?
Yes. We have different categories. The laboratories, we have maternity homes, we have diagnostic centers, we have the artificial reproductive therapy centers. Even the in thing now in Lagos, the cosmetic.
Oh, yes.
Yes, they're
also under.
Yes, because they do injectables, they have nurses and things like that. Yeah.
Okay. All right, so we'll give you the grace. You were going to your social media handles?
Okay, yes. Thank you very much. I wrote it. Okay, so our email is efama@lagostate.gov.ng. The Twitter is @efama_LASG. Facebook @efama. LinkedIn @efama. Instagram @efama2020. Yes. Thank you very much.
All right, so those are the social media handles. Once you punch Efama, it will bring it up for you.
Yes,
social media
it will.
Okay, thank you so much, Dr. Idowu Abiola, Executive Secretary, Health Facilities Monitoring and Accreditation Agency, EFAMA, for finding time to be here on the program.
Thank you so much for having me. Thank you.
We're speaking with Dr. Abiola, and she's taking us through the activities of EFAMA. And of course, you can't be a whistleblower if there's anything happening around you and you're not comfortable about those things. Please visit any of the social media handles and whistleblow. And like she said, you do not need to put your name so that your identity can be protected. We'll take a quick break. The conversation returns shortly.